My name is Cleet Younger, and I'm going to be the new medical director at the Transitional Care Center here in Cedar Rapids. I am very excited, along with the St. Luke's family, about this new building. We currently operate and take care of patients in a setting that we call post-acute care. Post-acute care is when a patient leaves the hospital and requires rehab before they go home. This is a very critical part of a patient experience, and that if you're in the hospital, the highest risk time is those first 30 days after you get out of the hospital. Two of the highest performing facilities in the entire state of Iowa for post-acute care are Living Center East and West. We have great outcomes, great data on those outcomes, and great patient experiences. However, those buildings are very old. And in those old spaces, we are actually challenged about providing that high level of care because of some of the adaptations we've had to make those buildings work. We are extremely excited about the opportunity from the Transitional Care Center. Not only will this allow us to have more space for patient care, but it allows us to have a modern facility where we will be able to provide the highest quality physical, occupational, and speech therapy. One of the things we're most excited about the new facility is the ability to separate people a little bit. So to have your own space, to have your own room, to have physical distance, to lower the risk of infection spreading from patient to patient. The physical space that the nurses and the therapists will operate in will be modern, large, and great for patient care. Patients will also have a physical space that they do not feel cramped and where they feel like they can achieve the adequate therapy and cares that they need. I treat patients like I would my family. I talk to patients like they're a family member. I explain what's going on in plain language, and we talk about the options for their care and where we're going to go forward. By doing that with families, you can make a significant difference in how they experience their care as well as their outcomes. We have great data showing that our length of stay and our cost of care as well as our complication rate is extremely low. But those are all numbers, and those are great, but the patient experience is very important to us. With a team of physicians, nurse practitioners, and nurses, we look at a patient's entire care comprehensively, look at what they're doing for medications, where their treatments have been to this point, and what we can do to manage their medical care in general. And we create a treatment plan along with a nursing plan and a therapy plan to get them from the point where they were ill to a point where they are healthy, and hopefully get them healthier on the other side than they were even before they had their illness or their orthopedic issue. As the medical director working with the team of nurses, nurse practitioners, and therapists, we couldn't be more excited about the opportunity for the opening of this new Transitional Care Center in 2019.